Hi, I'm Janae Zugates, and I'm doing my project for Module 5. So the first topic is the use of mental imaging or mental process when teaching motor skills. So mental imaging is the learning process that requires the student to visualize themselves performing the desired technique. An example of this actually is what Olympic skiers do. If you see them at the top of the hill, they actually close their eyes and visualize themselves going down the slopes on each turn and gate that they have to hit. This helps them continue to form the technique that they need in continued practice with mental memory, and it helps with continued repetitions. So when they actually do perform the task, they have maybe 200 repetitions in their mind when really they maybe only have performed 20. The benefits of this technique is that it has shown to improve motor coordination, it enhances muscle memory, it boosts confidence, and it has been beneficial learning technique actually in rehab centers, for example, with learning how to walk again, talk, eat, and all that kind of stuff. A case scenario that I'm going to use for the interpersonal case scenario is we have a 20-year-old young lady who is on her third visit, 3 days in a row for chronic abdominal pain, to the ER. And at this point has had every test underneath the sun done, and but needs to have basically a GI follow-up, primary care, established care, as well as gynecology, and possibly even more services if this is a psych issue that's causing the chronic abdominal pain, or what is it? The other caveat on top of being a young professional is she does not have health insurance but makes too much to get the standard Medicaid, and claims she doesn't understand how to get on to do Obamacare or the government Medicaid. So how do we assist this young lady, one, get her health care that she needs and continued health care with primary care follow-up as well as specialists' needs, but do it in an affordable way? So when you're doing this case scenario, you have to identify the who, what, why, and how of the scenario. So with this audience, so the first is who is the audience. The nursing students will be the audience, but then they will also be experiencing the complexity of uninsured young adults. They don't know how to use insurance, and most of them don't even know how to get them. And they're in this weird gap where they might not have a job that provides it, but then they're also too old to get their parents' insurance. So it's definitely a problem that's encountered. The complexities of the scenario are, again, it's a lack of understanding. They're in that weird gap where they might not have a job that can cover it, or they're not making the hours where they're getting full-time coverage care from their employer, but then are also too old where they can't get it from their parents anymore. And then also just don't know how to get onto the government website to even get the government health insurance that's financially based. So that's the complexities of it. Why is this scenario being developed? Because this is a condition that is seen very, very, very often. Especially when COVID happened, they opened Medicaid up to a lot of people, but just temporarily. Unfortunately, I know in January of this year, a lot of people lost their Medicaid immediately, and are also in this boat and don't know what to do from here. So it's definitely something that is come across very often. How will the case scenario play out? So first, we're going to have to help this patient find resources to find discounted health care. Does the health system that they're working with have financial ladders to go ahead and work with on paying bills? What can the billing office do for this patient? As well as, is there other healthcare clinics that they can go ahead and refer to them that will have better resources for there? Maybe even access her into the case manager at the hospital that can go ahead and help her out with the social and psychosocial sources that she'll need. Also, just maybe even sit down with the patient with the government website pulled up and just help them walk through real quick of how to fill it out. And then insist in making appointments with primary cares and specialists, even just calling a primary care appointment. Sometimes acting as the nurse on the patient's behalf kind of can get them in faster. I've pulled it off a couple times and it actually does work. And then the second step of this is go into the field. So possible, again, find a real case scenario. This is actually a real patient that I actually did this for. I saw her 4 days in a row and honestly called and found out that our healthcare system did do a financial plan based off of how much a person makes. And I called around to every office that was close to her or nearby and got her a primary care follow-up within 3 days. So it took maybe 5-10 more minutes of my extra time, but it definitely got her the resources that she needs to where she felt confident that she could pay the bills and actually do that as a follow-up. And then so using that as going into the field just to find actually a real resource in a real case scenario, but then also grabbing actual forms and showing the actual websites that you will use so that those resources are there and also already in these students' minds. So when they do actually go out in the field, they can pull from their scenario and utilize it when they're providing education. The third step is provide supplementary data. So when we're going through this scenario, I can provide her income. I can provide the resources that she has for income, what her future income may look like, what her access to transportation for medical visits are, what is her social and economic status, what is her social status, where is she living, is she homeless, what other multidisciplinary teams may be needed, what are different definitional diagnoses that are going on, is this all in her head, is she like pain seeking for pain pills, or does she like legit have a problem, does she have an ovarian cyst going on, does she have a torsion, what's going on in this abdomen, and then also seeing what kind of resources for insurance are available for her with her income status. I was shocked actually the plethora of resources that there are available out there, both on the state level as well as the federal level, for people to have some sort of access to healthcare. The fourth step is it will go ahead and double check the scenario. So if before providing it to students, run through another faculty member or have another couple of nurses, coworkers or even friends who are in the nursing field run through this scenario and see if it's a possibility, see if the goals are well defined with the objectives of the classes, and then also just see if the intended lesson and learning that we want to gather is actually going to be gathered in the intended fashion. And then the fifth step is integrate and evaluate. So we'll run the scenario through a couple of the nursing student groups and then tweak either the media that's used, the scenario, how it runs, the different learning techniques that may need to be different based off of the students that are in the class. It might need to be slower if it's more like a group of classes not as technological savvy, so they might not understand the websites that are needed or to even go to them. So just seeing ways that we can guide the students so that they know how to also guide their patients when they're out in the field. And then last, the scenario should also constantly be revised and revisited as updates are changed in the healthcare field, which is a rapidly changing environment all the time. Just as evidence-based practices change, we should go ahead and do that into our scenarios as well. The next step of this presentation is a clinical situation that can easily translate into a simulation. So I actually just recently had a patient that was perfect to be used. So he presented to our emergency room unresponsive but still breathing, still protecting his airway but completely unresponsive, kind of making these twitching movements, brought in by parents. Last light they knew is that he was on a fast for 4 days and just really only drinking tea. No health problems, smokes weed, doesn't do any other recreational drugs, and is 27. Only other medical health problems is that he has eczema. So he's protecting his airway for right now, but still, again, unresponsive, and we really don't know why. So the psychomotor skills that I want the students to learn on this is this patient will eventually need to be intubated. So I want the students to adequately set up for intubation, make sure that they have the proper equipment, that they secure the tube correctly, that they know exactly how to report the placement of the tube, and then that they adequately do the steps to check for proper tube placement. A cognitive skill that I want them to identify during the scenario is just to be able to identify at least 3 indications as to what will happen with this patient that they will present with that will indicate the need for intubation. My role as educator is I really want to develop their assessment skills early so that they can identify as early as possible the need for intubation. It's easier to do in a controlled environment when they're still slightly able to protect their airway instead of when they're absolutely no longer breathing and we have to do an immediate intubation without even using IRS medications. So we don't want to go that route. And then also I want to help and guide and provide confidence in the steps of acquiring the proper equipment, have it more almost be a muscle memory thing, as well as provide adequate resources like an algorithm real quick or mnemonics to go ahead and help them make sure that they have everything that they need, as well as the proper steps with pre-intubation, during the intubation, as well as post-intubation. And in the debriefing, again, it will just go through if there was any steps out of order, why they're in a certain order that they are, and again, the mnemonics and useful resources to make sure that all equipment is at the bedside. I'm sorry, excuse me. If this is in a scenario that's run in an actual trauma room that's actually used, sometimes I've noticed when doing scenarios in a room that's actually used, you kind of realize the room's actually set up not in an ideal way. So even kind of saying, hey, maybe if the difficult airway cart is over here instead of on the right, doing that during the debrief is awesome, as well as discussing just generally what went well, what did not go well, and of course what can definitely be improved on the simulation to make it more realistic. Another part of this is a scenario that can be used in this in the ethics course. I actually had this brought up as a student. Actually, no, my first couple years as this nursing, in nursing, and it's still kind of one that still questions me. So it's a scenario that is very good and it actually got brought to court. So an elderly couple, the wife was taking care of the husband. The husband had severe dementia, but she did not want to place him in a nursing home. Well, one night he had terminal agitation. Dementia got really bad and threw his wife down the stairs. She did not die from her injuries, but she had multiple broken bones, a subdural hemorrhage, a huge traumatic patient, was in the ICU on life support. At the time of this case, was kind of not expected to survive, but could. And then they placed the husband, father, in the hospital as well because he was so terminally agitated and debilitated with his dementia that he was not good to stay at home by himself, and of course did not have a nursing home. So he was placed in the hospital in a posy bed because he was so unable to be redirected. And the family was so upset about what he did to the mom that they actually wrote him off and he became a state ward of the state. His dementia was so bad, it was hard for him to understand how to eat or drink. So the final scenario or decision that the hospital was told was that the nurses were to no longer feed or provide fluids to the patient to eat or drink, to slowly let him basically starve to death. And then as he was going more towards the dying process, then get hospice on board and keep him comfortable. So there was actually a doctor's order from the state and court order for the nurses to not provide food or water for this gentleman. So we had to kind of sit there and watch him starve to death. So, and it was determined by the state because he was so greatly disabled from his dementia that it was almost a humane thing for him to go this way, especially with the family not wanting anything to do with him anymore. So that's my scenario I would do for ethics. And then lastly, a game I would create is I love crossword puzzles and word searches. And for the instructional methods is I would just provide definitions for each instructional method, and the student would have to guess like the main word for the instructional method, for example, gaming. So that is my presentation for Module 5. Thank you so much.